Welcome to Shape of the City. I'm Clover Frederick and I'll be your host. Unintentional injury is the leading cause of death in children and teens in the U.S. An organization called SafeKids is hoping that with knowledge comes the power to reduce preventable deaths in kids. With me today are Brian Baker from SafeKids Lincoln-Lancaster County and Melissa Kinzie from Lincoln YMCA SafeKids Water Safety Task Force. Thank you both for joining me today. All right, now let's start with Brian. Brian, what are some of the leading causes of unintentional injuries in kids?
Well, by far what we see the most of are falls. These could be falls from the same level, such as slipping, tripping, stumbling, that kind of thing, or falls from different levels, from level to level, such as falling off of a crib or chair, bunk bed, those types of things. But falls are by far what we see the most of as far as what we see treated in hospital emergency rooms.
Okay, now tell us more about SafeKids. What are the goals there and how to get started?
We have a very simple goal with SafeKids, and that's to prevent the #1 killer and disabler of children, which are unintentional injuries. SafeKids, locally here, we're part of an umbrella organization called SafeKids Worldwide. It was started in the mid-'80s by a physician in Philadelphia at the Children's Hospital there, and he just became weary of treating so many kids that he knew didn't have to be there in the emergency room receiving his care if something could have been done to prevent it, which he knew there were things to prevent these injuries from happening so that, again, he wouldn't have to spend the time and energy and money that it costs to treat these kids for those injuries.
Now tell me what SafeKids is doing right here in our community.
SafeKids Lincoln-Lancaster County works to address the leading local causes of unintentional injury to kids by looking at the impact that these injuries are having. So we receive hospital data that tells us what injuries are occurring, to what extent they're occurring, and what impact they're having in our community. So what we've done is we've structured ourselves into task forces that look at the leading causes of injury, and we mobilize the community and focus on how we can reasonably address each of these injury areas.
Okay, so what are some of those task forces, those injury areas here locally?
We have a water safety task force, we have a sports injury prevention task force, we have home safety task force, we have a child bike and pedestrian safety task force, we have a child passenger safety task force. So those are the injury areas that we look at here because those are typically the leading causes of injury in our community.
Okay, now this is a task that can't be done alone, so I'm sure you have partners in the community. Who are some of your partners?
We have over 50 partners that help us out at some level. Some of them open up their car dealerships to allow us to do child passenger safety seat checks. Some of them, like the YMCA here, allows Melissa to come in and actually chair the Water Safety Task Force, spend her time, some of the YMCA's resources to enable us to effectively address water safety. So we're so thankful for all of the commitment and support we receive from many organizations in Lancaster County to make SafeKids what it is today. And that's an effective tool that the community can use to address childhood injuries.
Great. Now that's a great segue into talking to Melissa about water safety, especially now that summer's coming up. Tell us what the SafeKids Water Safety Task Force does to prepare parents and children.
The Water Safety Task Force does a variety of things to prepare water for the summer in the water. We work with boat safety. The Game and Parks Commission, as well as the U.S. Coast Guard Auxiliary, does boat safety, and they're out every weekend out at our local lakes like Branched Oak and reminding boaters to use their life jackets and having Coast Guard approved life jackets and reminding kiddos to have those on because under the age of 13 they do have to have a life jacket. It is state law. In the city, we have a wide variety of organizations, including the Y and the Parks and Rec, and we work with pool safety, and we are working with the daycares and their providers and their staff on how to go to pools safely and keep those kiddos safe. And then we also work with the health department, and we're working on fence safety, home pool safety, because you don't have a lifeguard when you're at home, but how to do those things, have a pool safe at home. And We talk about drains, entrapment, fences, and a wide variety of things like that.
Okay, very good. Now, what's probably the biggest message you want the public to know about water safety?
The biggest message is supervision. Supervision, supervision, supervision. You cannot supervise enough. You need to put your phones away. It's very easy to have your iPad, whether you're at the bathtub or you're laying out and your kids are splashing around in their little pool on your driveway. You have to be watching. It takes seconds for kids to drown or near drown. It only takes 18 inches of water for a child to drown. And so supervision, supervision, supervision.
So how prevalent is drowning here, and what can parents do to prevent it?
Luckily, we are not Arizona and Florida, so it is not as prevalent as it is in those areas, but it's not something to turn a blind eye on. It is something that can happen in a second. Nationally, there are 3 deaths a day on average of kids that drown. And so we want to make sure that we are not on that map. We want to make sure that we have kiddos in swimming lessons to learn the rules, the policies, procedures, and just learning how to swim and feeling safe in the water and having a healthy fear of the water of where they can and cannot be. And it's good for the parents to know what their kiddos' swimming ability is so that they know when they go swimming together that they can do it in a fun way. But also just making sure that they know the rules and the water depths. If you are taking your kiddos to a pool that has lifeguards, obviously those lifeguards are watching everybody's kids. And so you still need to be able to watch your own kids, know where they can and cannot touch. Make sure that you walk around the pool and make sure that they know where those hazards may be. When you're out at a lake and you can't see the bottom, walk the water first. Don't just put your kids in a life jacket and throw them and say, go have a good time. Make sure that you know what hazards there might be, where the drop-offs might be, and how far the beaches may be so that you know where they will stop and go. Because you turn around for a second and they could be under the water.
Okay, very good. Now, Brian, besides water safety, what are some of the other safety issues that SafeKids is talking about this summer?
Well, one thing that we want to stress is for parents or anybody transporting kids never to leave a child in the car, especially now that we're getting to the summer months. The last 5 years, we've had an average of 40 kids die as a result of being left in cars. And so we don't want that happening on our watch in Lincoln-Lancaster County, Nebraska. So there are things you can do, such as putting your purse, your briefcase, your cell phone in the back seat with your child so that you don't forget them. Some people have even gone to taking off their left shoe and putting it in the back seat because you're not going to go anywhere without both shoes on. So that's one thing. And then the other thing would be to remind parents to always have their kids wear a bike helmet. So many serious injuries could be avoided, especially throughout the summer months with kids, if they just wear their bike helmet and wear it properly. So those are the 2 things that I would stress.
Okay, very good. Now, if there are people in the community that want to become involved or they would make a great partner, how can they learn more?
They can certainly call me at the Health Department at 441-8046 or go to our website, SafeKids Lincoln. Learn more about us and be involved as much as you can. We'd love it. Any support we can get, we'll take it.
All right, great. Thank you both for being here and for all the hard work you do to keep kids safe.
Thank you.
When we return, we're going to talk with an agency who's been in Lincoln for 40 years helping victims become survivors of abuse. Shape of the City is dedicated to helping Lincoln stay informed of health and wellness topics and events. Visit our calendar at lincoln.ne.gov, keyword 10health. If you'd like to see your event covered, email us at 10healthlincoln@gmail.com.